Why does air trapping occur in COPD patients? Imagine trying to blow up a balloon that keeps folding in on itself. That's similar to what happens in the lungs of someone with chronic obstructive pulmonary disease. When you breathe out, your lungs normally squeeze the air out of tiny sacs called alveoli. These alveoli are like small balloons that expand and contract with each breath. In COPD, two main issues interfere with this process. First, in chronic bronchitis, the airways become inflamed and swollen. They produce extra mucus, which narrows the passages through which air flows. Think of it like trying to breathe through a clogged straw. This narrowing makes it harder for air to escape during exhalation. Second, in emphysema, the walls of the alveoli are damaged. They lose their elasticity, meaning they can't recoil back to push air out. It's like a worn-out rubber band that no longer snaps back. This damage also affects the small airways called bronchioles. When these tiny tubes lose their support and elasticity, they tend to collapse during exhalation. Imagine squeezing a soft straw that folds in on itself, trapping air inside. Because of this collapse, air can't fully leave the lungs. The lungs then become overinflated, holding onto more air than they should. This excess air is called trapped air, and it causes the lungs to stay partially expanded even after breathing out. Another factor is that the damage to alveolar walls reduces the structural support that keeps airways open. Without this support, the small airways tend to collapse during exhalation. This collapse limits airflow out of the lungs, leading to what is called expiratory flow limitation. Since the lungs can't empty properly, each breath leaves some air behind, causing lung hyperinflation. This trapped air makes breathing more difficult, especially when trying to take a deep breath or exhale fully. It causes symptoms like shortness of breath, chest tightness, and a feeling of not getting enough air. So, in simple terms, air trapping in COPD happens because of narrowed airways, damaged alveoli, and collapsed small airways. All these issues work together to prevent the lungs from emptying completely, leading to the overinflation that makes breathing harder. Understanding this helps explain why treatments focus on opening airways, reducing inflammation, and helping patients breathe more easily.